Welcome, colleagues. Good morning, good afternoon, good evening, wherever you are joining us from. My name is Edwin Shumba, and I'm going to be your host for the next 2 hours. Welcome to this dissemination of the report on the status of the laboratory professional associations in Africa. As ASLM and FeLPA, we are really excited to reach this milestone where we will be sharing with you this report and taking a deeper dive to discuss the findings that we have on this report. On this webinar, we will allow questions, and we'll put our questions on the Q&A, and our panelists will then be able to attend to these questions as we progress with our conversation. We also have the report in French, English, and Portuguese, and we'll be sharing these for all of us to go through possibly after the meeting. So our meeting today is going to be 1 hour, 45 minutes, and it's a really packed program. We will have some remarks from Dr. Tokmo Maruta, who is our Director of Programs at ASLM. Then we'll also get some reflections from the President of FeLPA, Mr. Mutale Mubanga. Then we'll take a deeper dive into the report itself, where Mr. Sylvester Moyo from ASLM will take us through that report. We want to allow a lot of time and engagement as we then digest this report in this session. So we'll have a Q&A session, a reflections time, and then our president for FeLPA, Mr. Mutale Mbanga, will wrap it up with the next steps for this. So without much ado, I will invite our Director of Programs at ASLM, Dr. Tokmo Maruta, to give us some opening remarks. Over to you, Dr. Maruta.
So thank you very much, Program Director. And let me take this opportunity to welcome you, colleagues, before you are officially welcomed by Mr. Mbanga, who is the President of the Federation for Laboratory Professional Associations in Africa. Let me also acknowledge his presence and for hosting this meeting where we will disseminate the findings of the survey that most of you participated in. Let me also recognize the presence of the different associations from Africa, your leadership that is in this meeting. Thank you for mobilizing your members to come and be part of this dissemination meeting. Let me also recognize the presence of all the other members from the lab and diagnostic fraternity. We have found time to come and join us in this dissemination meeting, and all the other stakeholders and friends that are here with us. As indicated by Mr. Shumba, I'm from the African Society for Laboratory Medicine, privileged to currently serve as their Director of Programs. As the African Society for Laboratory Medicine, we do strongly believe that the role of laboratory professional associations cannot be disputed. Most of the people that are here, I'm very confident that you really understand and strongly believe that lay professional associations have a very critical role that they play within either the development, the strengthening, and the growth of the laboratory professional itself. In line with that, the African Society for Laboratory Medicine has recognized and really values the role of the associations, the role that they play, which is to serve and meet the interest of the laboratory professionals within our workspaces. Among these roles that the laboratory professional associations play are some of the following that I will highlight as I go. Firstly, laboratory professional associations have a critical role to play when it comes to the contribution in the development of the laws, the regulations that relates to healthcare. As laboratory professional associations, we should not shy away from participating in the development of some of the core laws and regulations that govern healthcare, because we are part of the provision of healthcare as laboratory professionals. Associations also play a critical role when it comes to continuing medical education. From the lab fraternity in the diagnostic space, this is science that is always evolving each day and each year. And there's need for ensuring that the laboratory professionals are always up to date. And associations, you play a critical role in continuation of medical education. Also contributing to the education of the public about the profession, and also providing that link that is needed when it comes to other health professionals. In other words, we should be the ones that connect laboratory professionals to doctors, to nurses, to pharmacists, and many other health professionals within the provision of healthcare, because we do play a critical role when it comes to ensuring that quality health services are provided and accessible to all. As laboratory professional associations, we also strongly believe that we should play a critical role when it comes to dissemination of information that's related to public health events and response. It's unfortunate that most of the time as lab professionals, we want to keep ourselves within the four walls of the laboratory, but our work extends and has an impact beyond just the four walls and the results that we issue out. Therefore, we need to participate in national events, in regional events, in global events when it comes to dissemination of public health events, of information that's related to public health events and response. A good case in example is during COVID-19, during outbreaks of Mpox, Marburg. As laboratory professional associations, some of you already have structures that do exist from the national to the sub-national levels. We need to make use of these structures to help the Ministry of Health disseminate some of the critical information related to some of these events that are of public health concern. Also, as associations, we should play a critical role when it comes to advocating for better working conditions for laboratory professionals. Who else besides us can speak about what we need? Who else besides us can speak about better conditions that we need to work with and work under when it comes to the laboratory profession? We are not saying we should be, politicians, or we should be labor unions, but we need to speak about this in a manner that's palatable to the systems and the governance structures that we operate from. Also, importantly, networking. Laboratory professional associations, we need to play a key role in facilitating the connections among ourselves as laboratory professionals, and also, like I've said before, beyond into other healthcare professionals. We need to take a very positive and purposeful step in fostering collaborations as well as knowledge sharing among ourselves and even across to other professionals and beyond just healthcare professionals, the communities from which we come from and which we serve. Quality assurance. As laboratory professional associations, we also need to get involved and work to establish and promote quality standards that ensure that best practices in laboratory medicine, best practices in testing, and best practices in management of diagnostics is what we should be known for, to ensure that there's quality and accessible health care to all. As ASLM, to demonstrate our commitments to supporting and development of the lab professional, when you look at our strategic priority number 2 of our 5-year strategy, which says we need to work towards building and organizing the lab profession, we seek to work with you in a number of areas, including assisting professional councils, professional associations, with key critical formation and operational issues like helping you develop your strategic plans, helping you develop the operational plans, and develop your systems so that you can be able to serve the communities that you serve and the lab professionals effectively. And also work with you to and support you in hosting some of your conferences, which in the previous years we have managed to participate. To date, we have signed MOUs with about 24 laboratory professional associations in the continent. We have also supported hosting of some of your annual conferences, and we have also supported some of your associations in the development of your strategic plan, among many other interventions that we were able to do within the limitations of our bandwidth, as well as financial resources that are limited. These are very small steps compared to the desires that we have. But as they say, great things are done by a series of small things brought together. We strongly believe that at one time we'll get there. As I have listed before, our desires are plentiful. I'm sure you also have a basket full of desires that you need to see being met and get assistance from. And we do recognize that we are all operating in a very challenging environment. From our observations, some of the key challenges that as associations we are facing include the following. Firstly, most associations are poorly resourced. I'm sure this report that we receive today will also point in that direction. There are limited financial resources that are available to support a lot of your ambitions, a lot of the activities that you wish to do, the activities that you have planned for. Another challenge is low membership levels. There's no members, no associations. And unfortunately, not all laboratorians within your countries, within your jurisdiction, do subscribe to associations. And those that do subscribe, a few are very active. This is a real challenge that we need to put our heads together to say, how do we address the elephant in the room, low membership levels? Because with no members, there are no professional associations. Another challenge that we have observed whilst working with you in the past few years is that most associations are not officially or fully recognized by their own governments where they are operating from. This is based on a number of things, one of which is just that there is no lack of trust between associations and governments. Like I've indicated before, sometimes associations are viewed as those militant labor unions that only speak of the needs or the wants or demands that they are making to governments. We therefore need to be very innovative to say, how do we strike a balance between our needs and also push and help the government to push the agenda for an effective public health and laboratory systems and diagnostics within our countries. Another challenge we have observed is that most of the associations, those that are established, are not supported by regulations. In other words, there is usually nothing somewhere, either within the government or within the association themselves, a document, a regulation, a policy, or a law that really establish or recognize the existence and the work that you as associations do. Lastly, the recognition by the disaggregation within countries. If you look around within your countries, you may realize that there's more than one professional laboratory association in your country. Even in this meeting, you may find that there are 2 or 3 associations that are coming from the same country. This disaggregation really disempowers us, because the more we are divided, the easier is it to conquer us, and the weaker we become, because we can't speak in one voice. So these 2 main associations that we have usually lead to disorganization and split between the potential members that we have. I know I've spoken a lot about some of the challenges we have, but despite these ever-increasing and changing challenges, we must remain resolute. As they say, it is the brave man. The brave man is not the one who does not feel afraid, because we all know the challenges that we face. We all know these mountains that we have to climb. But they say the brave man is not the one who feels afraid, but is the one who conquers that fear. And this is exactly what we need to do. We need to face these challenges headlong and work together. So as I close, let me thank all those who have contributed to the gathering of the information on the status of laboratory professional associations in Africa, which we are going to receive today. This is very important that we understand where we are in order, in order that we can then be able to design context-based, implementable solutions that can resolve the actual problems that are on the ground. As they say, a problem that's well stated and well described is actually a problem that is half solved. So this report is very important in defining our next step. Let me thank the ASLM team, the ASLM leadership, led by Mr. Edwin Shumba, Mr. Silvesa, our comms team, the leadership from FeLPA. leadership from the associations, the members that responded and provided the input to the survey that led to this report. With these remarks, let me end here and wish you all a very interactive and useful and progressive discussion as we receive this report on the status of laboratory professional associations in Africa. Thank you very much, and back to you, Mr. Shumba.
Thank you very much, Dr. Tokmo, for those very powerful words, reminding us that ASLM recognizes the critical role that laboratory professional associations play in terms of development, strengthening, and advancement of the laboratory profession on the continent. Really wise words from you, sir. Thank you once again. We now turn it over to the president for the Federation of Laboratory Professional Associations in Africa, President Mutale Mubanga. Say we invite you to give us your FeLPA remarks.
Good afternoon and good morning, depending on where you are connecting from. I would like to, first of all, sincerely thank the ASLM team for organizing this meeting in partnership with the other leaders from the Federation of Lab Professionals in Africa, who have been working behind the scenes, reviewing the input, following up the surveys, and all to get us to where we are today. I also want to thank the Biomedical Society of Zambia for the opportunity that they have given us to be available to FeLPA and in partnership with the other associations on the continent. So thanks to the members, as well as the individual members of the associations that are in this alliance, so to speak. And we also want to extend our thanks to all of you that have found time to join this meeting. I had to negotiate with my boss that can I take this meeting from this time until it ends, and he graciously put off a meeting so that we could be available. And I was just imagining how many of you are sharing the same story. And I say that because we are all leading. You may not be carrying a title of president or secretary general or vice president, but we are all contributing and leading in many ways, such as just making people available to attend transformative meetings such as we have this afternoon. So thank you so much for joining. And I want to belabor what Dr. Tokmo has already spoken. We had already had discussions in the background in terms of how this meeting would go, so that we don't bore with repetitions necessarily. But perhaps for you that join, that follow the news, in The Hague, in the Netherlands, there's a meeting going on right now by NATO, or the North Atlantic Treaty Organization. It's a military alliance that's made up of over 30 countries. And they are really rethinking their strategy in terms of how they respond to all these global shifts and geopolitical circumstances that they have found themselves in. How they will respond to different threats that are coming from the East, from the West, from the South. How they respond to the formation of BRICS, that's Brazil, Russia, India, China, South Africa, and how they can reposition themselves to sort of remain ahead of the pack. Why is that necessary? It's because when you look at the countries that are in the alliance, the NATO, for example, they are rich countries that can very easily say we are enough on our own. But as we have known here in Africa and everywhere, there's power in numbers and there's power in unity. You can imagine if Zambia, for example, had to go to war with this alliance, and their motto is that when you attack one, then you have attacked everyone. So you're going to be fighting 30 countries, and that's really the power of numbers. So we may have a genuine concern in Zambia or Tanzania or Burundi, but that voice can only do so much. That voice can only go so loud. But when we combine our voices, then we are going to have a much, much bigger impact in what we do. So when we met in South Africa in 2023 at the ASLM conference, That was the idea. How can we start taking charge? If you have read the book by Steve Covey, The 7 Habits of Highly Effective People, there's a very short statement that he makes in that book that's really powerful. He says, if we are accountable, then we will be response able, or in other words, accountability breeds response ability, not responsibility, but response dash ability. And basically what he was saying was, anytime that you think someone else is responsible for your problems, you're not going to do something. You're not able to respond. Why? Because you think the one you think is responsible for your situation is the one who must respond. But given the shifts again that we have, we are just recovering from the disruptive stop work orders as Africa and the damage that it has caused, colossal damage that it has caused to our lab systems. If we again continue shifting the blame on other people for our situation, then we who are in this lab profession are not going to do what it takes. We're not going to engage with governments. We're not going to engage with other partners for us to solve the problems that we are solving. And this is why, from a strategic perspective, we wanted to check what associations or which associations do we have in Africa? What are they doing? What do they stand for? Where are their weaknesses, or where are our weaknesses? And how can we come together so that we can strengthen the lab voice? Just a few days ago, I was discussing with my friends saying, it's not our president, Hakainde Hichilema, to do something about laboratory medicine, because the man is not even from a lab background, is not even from a health background. But it's us who have the esoteric knowledge, the nitty-gritty knowledge about lab medicine that must amplify our voice and stop waiting for us to be called for meetings, but actually us being the initiators of these meetings. So we hope that the survey that we have conducted is going to unite the discussion. When we were putting this program together last week, we wanted to allow for enough time for us to discuss, because we want the conversations to flow from all of you, over 250 people that are gathered here, to have your voice, to contribute, because none of us is smarter than all of us. So we hope that as we share these results, there will be a means that are going to pull us together in one direction so that we can, each of us, do something. So we don't have to wait for those that are in classical leadership teams necessarily, but whatever idea that you have, you think can move the profession forward, please come forward, because none of us is smarter than all of us, as Ken Blanchard said. And then money will follow ideas. So we not start from the money that we have, but from the big ideas that we have, and resources, human, financial, or otherwise, are going to follow us. And I hope that that sets the stage for us to go into this conversation. Thank you so much once again for attending and for being there. Over to you, Edwin.
Great. Thank you so much, President Movanga, for those very wise words, reminding us that no one is smarter than all of us. We are smarter together. Thank you for sharing those wise words. To move us to the next agenda item, we'll invite Mr. Sylvester Moyo, a program manager with ASLM, who has been at the center of supporting the FeLPA as part of the secretariat for FeLPA at ASLM, who is going to quickly take us through the status of the lab profession report. I invite Mr. Sylvester Moyo to take the floor now. Over to you, sir.
Thank you very much, Mr. Shumba. Please confirm if you can see my slides.
Yes, we can see them and hear you clearly.
Great, thank you so much. And thank you once again to Dr. Tokmo and the ASLM leadership, and also thank you very much for the leadership of the Federation of Laboratory Professionals in Africa. So just as mentioned, we conducted a survey that I'll just provide a high-level overview of some of the insights we have now from this report. We also have made sure that this report is available in English, French, and Portuguese, and we'll make sure that we also disseminate this report soon after this webinar. But without further delay, I just wanted to provide on behalf of FeLPA, just to provide some overview of this report and what to expect and some of the key highlights. And I'm glad to already hear from Dr. Tokmo and also from President Mwanga how this report is going to help shape some of the initiatives at ASLM working collaboratively with FeLPA. So just in case for the benefit of those that might not know what is FeLPA or are busy asking, what is this organization? So FeLPA stands for the Federation of Laboratory Professionals in Africa. And this is a regional body really that is trying to bring together all the lab professionals associations across the continent. And this regional body was actually launched in the last ASLM biennial conference in the ASLM 2023. And in this association really was trying to bring together all the professional associations across the continent. So currently in terms of the FeLPA governance structure and some key terms of reference for what FeLPA is working towards, we currently have the leadership structure has President Mubanga, who's also the president of the Association of Zambia, BMSZ, who is the chairperson. And the deputy chairperson is President Alibu Patrick Dennis from Uganda. We have President Safari Kiti from Kenya, who is the secretary. And then we have regional representatives, where we have President Yahya from Tanzania, who is the East Africa representative. We have President Abu Abund Rahamani from Ghana, who is the West Africa representative. And we have President Admire Chakuma from Zimbabwe, as well as President Blandine from the Democratic Republic of Congo as the Central Africa representative. So FeLPA, in terms of what FeLPA really is trying to do, is to advocate for the recognition and advancement of lab professionals through engaging, of course, with the global and regional structures that are in place. And as you might have heard from Dr. Tokmo, that this is something that, as ASLM, we say we are the lab voice, but we can't be the voice without the profession. So really FeLPA is coming in to try and amplify that voice together with us. We also want to establish and promote governance, regulatory structures, and also statutes for practicing lab medicine professionally and ethically across the continent. And lastly, also to support the establishment and strengthening of well-governed professional lab associations at the national level. Now, some of these associations that we brought together, they are at different levels. Some have been there for some years, some are still new and upcoming. And as mentioned, some are active, some are not active. We are trying to bring everyone together so that they can learn from each other and build better structures to support the profession. So as ASLM, we have a 5-year strategic plan, and how this all ties in is that we have 4 strategic priorities. And under strategic priority number 2, which has been mentioned by Dr. Tokmo, which is to build and organize the lab profession, we had some activities that we had planned for under this strategic priority. And this is what also brought about the establishment of FeLPA as well. So these were just some activities that we thought of trying to achieve as part of achieving this strategic priority. So this is just an overview of what we hoped to achieve through FeLPA. Then coming now to the report. So as mentioned, under strategic priority number 2, which is to build and organize the profession, ASLM has been working collaboratively with FeLPA. And the way we've been working together in terms of also the terms of reference that we've mentioned is really to support medical lab associations across the continent with aspects of strategic plan development, hosting annual conferences that they have, Also, most importantly, membership recruitment. At ASLM, we do have a membership program, but we also know that the medical lab associations have a membership program as well. We want to get more people behind these national medical lab associations, as well as also part of ASLM. We also are working with FeLPA towards looking at opportunities for training and capacity building, largely also again through the ASLM Academy platform that many of you might already know, as well as through the membership program that we have at ASLM. And also, most importantly, I think as mentioned, the funding landscape has changed dramatically. We are trying to work with FeLPA in supporting the medical lab associations in terms of diversification of funding, which is very important. There are many great initiatives that medical lab associations are looking to implement, but we need funding for some of these initiatives to be realized. So we are looking forward to try and look for opportunities where we can have joint implementation of projects, joint application for grants, and other similar initiatives. So to date, ASLM in conjunction with FeLPA, we conducted a survey. The main aim of this survey was really just to assess the status of medical lab associations across the continent. The reason for this also was to identify the challenges that are there, that are faced by the medical lab associations, identify the strengths as well as opportunities that already exist for strengthening medical lab associations. So to date, we are happy to say that through these collaborations, we have managed to engage 24 medical lab associations, as indicated on the map there. The ones in green, we actually have a memorandum of understanding signed with them. And the ones in yellow, this is something that is still in progress. And then at the time of the survey, out of the 24 medical lab associations that we've engaged, we had managed to send the survey out to 20 of these medical lab associations. So I will now move on just to provide an overview of the findings from this survey that are detailed in the report. So in terms of the survey methodology, we conducted this survey between the 5th of September last year to the 1st of November last year. This was mainly an online questionnaire that covered aspects of operational status of the medical lab associations, their financial standing, as well as their strategic priorities. And, you send out a survey, there'll be challenges. Some people might not be able to respond, but happy to say that in terms of response, we had 12 out of the 20 medical lab associations representing a 60% response rate. And as you can see on the map there, those are the respondent medical lab associations. So now moving on to the key findings that are detailed in the report, I'll just start with the operational status. So it was very interesting to note that, medical lab associations have varying levels of establishment. We had medical lab associations as old as 9 years, all the way up to 57 years, which is very significant. And this also highlights, the different experiences that these medical lab associations have and potential benefits of how maybe the younger medical lab associations can also gain from those that are more experienced and have been established for a while. 92% of the medical lab associations are legally registered, with most registered with the government ministry or the regulatory authority in that country. So this is something that is good. We want to see more of medical lab associations getting this recognition, because then it places them at a unique opportunity to, be a voice for the lab profession and also influence some of the policies that will benefit the profession. We also then asked the medical lab associations in terms of their growth over the past 5 years, covering 2019 to 2024. And 58% of these medical lab associations reported significant membership growth during the period, while 25% reported moderate growth. And lastly, 17% reported either a slight increase or a slight decrease. When we look at the mandate of the medical lab associations and their activities, most of the medical lab associations who responded indicated that they're mainly focused on capacity building, and they mainly do this through conferences, the annual conferences that they have, training opportunities, as well as identifying CPD programs that professionals can engage with. They also mentioned that they're also focusing on advocacy and policy engagement, as well as networking and collaboration among their professional members. But in terms of also gaps under this particular area, they mentioned that they've got limited involvement in terms of research and publications. Most of the medical lab associations would like to be more involved in research aspects, as well as also publishing as a medical lab association. And also, they also mentioned that as much as they do have membership, there's low engagement in terms of policy formulation, as well as also licensing of professionals, which is something that they would like to lend their voice in their respective countries and regions as well. When we move to the financial status, most of the medical labor associations really operate on limited budgets. I think this is something that has been mentioned also by Dr. Tokmo, that the majority, which is 58%, mentioned that they have an annual revenue that is below 10,000 US dollars, and only 33% reported revenues of between 10,000 and 50,000 US dollars annually. So really not much budget available, and this is something that, as I mentioned, is something that FeLPA and ASLM are trying to work towards. In terms of the major funding sources for the medical lab associations, these are mostly from membership fees. However, they are often low. That is something that was indicated across the respondents. And some of the respondents indicated that the medical lab associations engage in occasional grants or sponsorships that they receive, as well as also engage in some limited income generating initiatives to try and, generate funds that they can use to, for example, have those annual conferences that they have. We then also looked at the key priorities. So over the next 5 years, to try and also align this to the ASLM 5-year strategy, we then asked them, what are the top 5 priorities that you as medical lab associations would like to achieve over the next 5 years? So membership growth came up as one of the first top causes, top priorities. So most of the medical lab associations want or are looking at strategies to increase their membership. They also mentioned financial independence because obviously for you to be able to sustain and keep implementing some of the initiatives, you need finances. Also, linked also to membership growth was continuous professional development, because this is something that their members require annually as part of also licensing and registration in some of the regions and the countries. Also, top 5 priority was to be involved in advocacy and influencing policy around the profession, as well as networking and collaborations. So one key thing also, the medical lab associations also indicated that as much as these are our priorities, to achieve them, they also recognize that they really need support in terms of capacity building internally, to have skills as medical lab associations in terms of project management, resource mobilization, as well as leadership development. So this was something that was common across the responding medical lab associations. So now I will quickly move on to the challenges, the recommendations, as well as the next steps coming from this report. So in terms of the challenges that were identified, the first one was the low financial sustainability that limits the medical lab association activities. And this, as ASLM, we saw it mostly. We would have loved to support all medical lab associations who have their annual conferences, but at the moment we had limited resources, and we were able, however, to support some of these medical lab associations in terms of their annual conferences. So this is some of the challenges that they also, I think, was common across the medical lab associations. The inconsistent membership growth as well is also something that was indicated as a challenge. And this also speaks to, what that Medical Lab Association, in terms of activity, you find that if there's inconsistent membership growth, then in terms of activity as well, that Medical Lab Association is not very active. Again, as mentioned, the limited research involvement and lack of published outputs. This is something that most of the medical lab associations indicated that if they are, get opportunities to be involved in a lot of research as well as publishing outputs, this also brings recognition to the Medical Lab Association and something that can be leveraged. Again, as mentioned by Dr. Tokmo, limited recognition, legal recognition in some of the countries. You find that, unfortunately, some of these medical lab associations, using Dr. Tokmo's words, are considered militant or are not really engaging well with the different governments. So this then limits also their influence in terms of policy aspects around the profession in those countries. And lastly, also, I think the medical lab associations who responded were candid enough to mention that also in some of the challenges include weak leadership, governance, and governance structures in some of the medical lab associations, which then affect their effectiveness in how they run things. Then, in terms of the recommendations that are there in the report, really the first recommendation is to strengthen membership recruitment through awareness campaigns and incentives. This is something that ASLM and FeLPA will be collaborating in. I think, in short, yeah, we are just looking at, there's a saying that says safety in numbers. So the more you are, as I think also mentioned by President Mutale, our numbers, no one is bigger than all of us. So coming together, having more members also join their respective associations in the country, that raises the lab voice that ASLM wants to raise on the continent. Also advocating for policy changes that will mandate medical lab association affiliation for professional registration. This is something that we also view as a low-hanging fruit. If we can get more, members registered under the Medical Lab Association and have some kind of policy change to mandate that for people to get registered in their countries, they also need to be part of their Medical Lab Association. This is something that has worked in other countries as well. Then enhancing financial sustainability. There was an example of a country that was also doing auto deductions through their employers. So every month or annually, as they get paid, there are some auto deductions that are made towards their medical lab association. And this is one way to get that financial sustainability. Also engaging and collaborating, not only just ASLM and FeLPA, but even medical lab associations across each other, applying for those competitive grants and also working together in terms of investment strategies. And lastly, but not least, coming from the conferences also that the medical lab associations have been able to be doing over the past years, public-private partnerships have really come out strong as a way that medical lab associations can enhance their financial sustainability. Also, in the recommendations to improve the leadership and governance for medical lab associations, and this really is tied into the sustainability in the long term. So this is something that we hope that we can work together with the medical lab associations to strengthen as part of also having a long-term view of the role of the medical lab associations. And lastly, also establishing the regional networks and the collaboration platforms. This is something that is really required to do. In terms of the next steps, and just in summary, based on the findings that we have, the next steps will involve engaging more with the medical lab associations to implement some of these targeted capacity building initiatives that they have and that they've highlighted, to also work on developing resource mobilization plans for financial sustainability, to strengthen ASLM and FeLPA's support structure for the medical lab associations. And also, and most importantly, we know that as much as we've been engaging with the professional associations, the students who are the future leaders are also very, very important. And with this, I just wanted to highlight that ASLM and FeLPA have been engaging with the African Federation of Medical Lab Science Students Association, who I hope are represented in this call. And we really, value this because we know that these students are students today, but are going to be our future leaders going into the future. So having them involved right now, having them also involved in the professional associations and engaging right now as their students is going to be very important. And this is something that we will be driving towards. Otherwise, with that, I would like to thank you and hand it back to you, Mr. Shumba. Thank you.
Great. Thank you so much, Sylvester, for that very insightful presentation. I think the summary was well done. And I think there are three main issues that you brought out in this high-level summary. Issues around capacity of these different associations, the challenges that these associations actually face, and what is the future that all these associations see. So I think that really came out quite strongly. So we want to pause a little bit and invite our president and chairman of FeLPA, President Muwanga, to just give us a few reflections following the presentation from Sylvester on that report. And then we'll turn it over also to Dr. Maruta to quickly just give us some reflections. We will then allow all of us, like we highlighted, that we really want this to be more engaging, to also come in. Feel free to use the Q&A box to put in your comments. We see comments are coming through. Keep them coming. So President Muwanga, if you can just give us some quick reflections.
Yeah, so thank you very much again, Sylvester, and thanks everyone for sticking around. Yeah, so as you have said, we want to give as much time to the people that have gathered here to also ask questions and maybe contribute their ideas. But again, as has highlighted by the report, I think we need to search deep within our souls as professionals. What is it that we really exist for? And that should then drive the priorities that we set so that we are not distracted, chasing little rabbits, so to speak. And that's the reason we did this survey. When we came together as the leadership team for FeLPA, it's always tempting sometimes to show progress or movement very quickly. But we recognize that we come from very diverse backgrounds with different challenges that we had little understanding of. And the idea for this was for us to get real insights into what's happening in the countries and then craft targeted interventions that are going to scratch where it's itching, so to speak. Of note, I think, is the issue that was raised in terms of licensing. For example, there have been some countries I've been to here in Africa where there are no laws for licensing. You just finish your school, you convert your house into a lab, you brand it with your name, and off you go, operating a lab. The personnel themselves that are testing, what are they trained in? Nobody's really regulating, and what kind of facility can do that? So we saw this as an opportunity for us to start comparing notes, as has been highlighted by the report. And then we're also looking into solutions around training and competency frameworks. I remember when we were writing the curriculum for specimen referral, which Africa CDC are using, we were in Uganda, I think in 2022, where we met and somebody asked a question, a very important question. It says, is this training going to be recognized? And then I remember Dr. Tokmo answering, recognized by who? And that got me thinking, because oftentimes we think that solutions that are made in Africa are not good enough for Africa. But we are the ones that are in this continent. So Africa must galvanize, we must organize and forge solutions that will work for Africa. So whether it's training or competency, so we can craft professional qualifications for lab, we can restructure, diploma degrees, and also that we are harmonized. Recently, when we were in Namibia with President Hiaya from Tanzania, we were speaking at the conference there, and we were also with President Wendy from South Africa. The Namibians had a concern. For example, you are registered in Namibia, then when you go to practice in South Africa, again, it's a hassle for you to get registered to practice your trade. The same thing, you're coming from South Africa to Zambia, we are going to make you go through rigorous regulatory issues, but is there a way we can start harmonizing these things so that, we are more fluid? What's recognized in Zambia should be recognized in Kenya to the extent possible. So really, that's where we are going. Dr. Tokmo talked about quality assurance and certification programs, helping countries to develop national accreditation bodies. All this is around what we really exist for, while we are advancing as persons, individuals who are career people, and there's a place for that. But also, how do we look beyond just us making individual career advances to actually influencing laboratory medicine at the continental level and even outside of Africa? Those would be my quick reflections for now, and we hope that the insights here will help us organize better as associations, which are channels of this kind of change that we are looking for. Thanks. Back to you, Edwin.
Great. Thank you so much, President Mubanga, for those reflections. I will invite Dr. Tokmo to just give us some quick reflections, and then we'll take the questions that we have on the Q&A. Dr. Tokmo, sir.
Thank you very much, Mr. Shumba, and thank you, Sylvester, for this very, I think, succinct and comprehensive submission of the report. As he has indicated, this report is will be available or is available in several languages, which will be shared during this meeting. Perhaps, Sylvester, if possible, you can also drop some of these the reports in the different languages in the chat box, in case there are others we have not seen it. So I think very quickly, thank you for the report, which as ASLM we receive very well. The message that has come across is very clear. The action-oriented recommendations are also very clear, and this will serve as the compass directing us and directing our efforts from here going forward. Like President Mwanga, let me also take the opportunity to reflect on some of these recommendations that have been shared. I think right at the top for the report in terms of recommendations was the issue of membership recruitment. As I said earlier on, no members, no association. And us as ASLM, as a membership-based organization, we really understand fully what this means if you don't have a strong base for members. Central to our approach as ASLM to help address this issue of membership is not to compete with national associations for the same members, because we also trying to recruit members from the same pool of professionals. So central to our approach is not to compete with national associations, but rather work together to ensure we drive the membership for both national associations and ASLM whilst we build membership base for all. So in line with that, we as ASLM has come up with a membership structure that take cognizant of this, and we've come up with the following recommendation. Our membership, ASLM membership structure has got different membership levels. So you can join as an individual under the Lab Pro, which is called the Lab Pro. These are working professionals. You can also join as an organization and also join as a student. So we have made provisions for associations to join as institutions. So your association can join the ASLM membership as an association as an organization at a minimum annual rate of $200 per year. So as an association like AMLA, the other associations in the continent, you can join at a fee of $200. So what this means is, once you join at that fee of $200, your members, the members that are within your association, it will cover the first up to 50 students who are already your members of your associations for free. So it means the students that are the students in your country or within your jurisdiction, if they join you, they then do not pay for membership at ASLM. So the first 50 will be able to get the membership fee as a student for the ASLM membership for free. So what this means is we are also contributing to helping you capture these professionals whilst they're still students, so that as they graduate, they are already aware of the association in the country, and then they can continue to do so. And then for the additional members from 50 going upwards, that they will also have then a discounted membership fee. Instead of paying, I think it's US $10, they will then pay around US $7 for their membership. So it also encourages these students to join our associations. We also, for the Lab Pro members, so those that are working professionals, if they are a member of the association in your country and the association has joined our membership at US $200 a year, they will then also have a 25% discounted fee. So instead of paying the full fee, I think of $40, they then pay a reduced annual fee of $30. So what it means is, if a professional from Namibia, for example, if they decide to join ASLM directly, they will have to pay more. But if they join the association in Namibia first, provide proof and evidence of being a member of the association in Namibia, they then get a 25% discount for the membership at ASLM. So this is, I think, a response to the report that we've just received, where we are struggling with members at national level. This, as initial steps, is a small contribution we would like to make towards encouraging more professionals within your countries to join your association. The other piece and recommendation that came out in this report is around advocacy for policy change. Let me also say we are excited about the Federation of Laboratory Professional Associations, which we jointly launched together on the sidelines of the ASLM 2023 conference in Cape Town, which I think for us is a platform that is going to serve as a unified platform advocating for the recognition, for the advancement, as well as for regulation of laboratory professionals across the continent. So it is our hope that this platform will also serve as the voice for the laboratory, for us to speak with one voice and ensure that our voice can be heard. So we would like to encourage the leadership from FeLPA to continue to take advantage of the existence of this FeLPA as a regional platform, which can then speak and have access to even some higher offices and higher levels and higher leadership, political leadership in the continent, which otherwise may not be accessible as individual associations in the country. So again, this is a small contribution we would like to provide as ASLM to continue and also address the issue of advocacy for policy change, which was raised in this report. Also, the biggest elephant in the room, resource mobilization. I have also seen some questions from President Aswiri from Kenya. He's also asking about what are the strategies that are there to make sure that we can resource and mobilize resources for associations, because without money, the things will not move. Funds, they oil up the things that, and the many wishes that we have as associations. So I think as ASLM, we agree with this recommendation that we need to identify innovative ways for resource mobilization as associations, as ASLM together. We need to start thinking outside the box from the traditional resource mobilization of membership, because our members are low in the first place. Even those that are there, payment is an issue and keeping up to subscription. So we really need to think outside the box to say, how can we raise resources to mobilize for the functioning of our association. And this is really a ball that is in both courts, your courts and our court. But as ASLM, here are our few thoughts. Firstly, as ASLM, we would like to work with associations as sub-grantees to many of the programs that and projects that we implement in your countries, where we can subcontract you as associations. For example, if we have lab system strengthening interventions, for example, we have funding provided to us to support mentorship in Zambia, to support audits or assessments in Eswatini, instead of us engaging consultants and other institutions. Why don't we subcontract associations so that then these projects or these activities can then be implemented through associations? We have done this before with the association in Botswana many years ago, where we had some funding from FeLPA, and instead of looking for individual consultants, we approached the association and subcontracted them. They then made use of the professionals that are part of the associations to be the people that then will go on the ground. So this is very possible, and this is very feasible. But for this to happen, there are certain things that needs to be in place, because we are talking of resources that we are also receiving from other organizations, which we need to account for. So for this to happen, we need guarantees for fiduciary compliance. In other words, accountability for this fund is going to be key. Unfortunately, most of the associations, as we have seen from this report, they do not have demonstrable financial systems that can be able to absorb these funds, utilize them, and be able to have financial systems that can account for these resources. What then it means is we need to start from a few steps back, looking at how can associations be supported to establish these very strong financial systems that can provide the accountability that is needed. If this is in place, as ASLM, we are available to explore this option of subcontracting associations to do the work. In any way, in any case, the consultants that we hire or we engage, if we go to Lesotho, for example, these are members of the associations that are there. If we go to any country that we can think of, these are laboratory professionals. And in a way, we can also then encourage them to join the professional associations because of the direct benefits that they may get. So issues of ensuring that we have demonstrable financial systems will be very important if this has to be a reality. Again, another way that we can mobilize resources together is joint applications of grants. We need to tackle this from both ends. As associations, please do not hesitate to engage us. If you see opportunities, if you come up across opportunities, and we can have joint applications of grants. As ASLM, we do also have infrastructure like the ASLM Academy, which can host some of the initiatives like your trainings and offer certifications through our already accredited courses. So if you have grants that are there which need training and capacity building, mentorship, and so forth, we do have a platform that's already there, the ASLM Academy, which can host, which can enroll and offer online, live, and even online at their own pace courses. Some of the courses are already accredited, and we can work together to make these joint applications, and you can benefit from some of the resources that come through that. Another, I think, recommendation that came in this report is on leadership development. You know, as they say, leadership is the capacity to translate the vision into reality. We have our wishes, we have our visions, but without strong and appropriate leadership, it's like we are blind being led by another blind person. And there are only two places that we can end up in. Either we end up nowhere or we end up in a pit. So issue of leadership, I think, is very, very important. So as ASLM, we recognize the role of leadership. And let me also inform you that we are just finalizing a review of existing lab leadership training programs in the continent as well as globally, for us to identify what are the trainings that are there for lab leadership, what are the gaps that exist, and what is it that we can offer. So we will be moving into steps of developing a very comprehensive lab leadership training. And we have already partnered with one of the diagnostic industries. We have offered to support and provide seed funding in developing and rolling out this training through our Laboratory Directors Forum. But it is our wish that FeLPA, through FeLPA, associations can also benefit from this lab leadership training once it starts, because you need strong leadership at the association level so that you can lead the rest of the members within your network. I think another issue that also came out very strongly is on network and collaboration forum. So they always say, if you want to move fast, just move alone. But if you want to go far, we need to go together. So networking and collaboration is going to be key. And FeLPA was actually born out of this great need. In addition to it being a tool, a platform for advocacy, it is actually a platform that in our minds can serve to converge professionals for networking and collaboration. So I think our challenge that we have, both of us right now, is what tangible activities can we do to keep this train growing longer, as well as to keep the train moving. And here are some of our thoughts as ASLM. We would like to maybe put it to the leadership at FeLPA that we organize scheduled webinars. So we have a schedule for the year. It could be once a month, it could be every quarter, but you have scheduled webinars that serve the purpose for bringing together lab professionals as a means of knowledge exchange, sharing our experiences, and learning from each other. So these online meetings, online seminars, as ASLM, we would like to offer our already existing platforms that you can then utilize to host these at no cost to the associations. So let's have this yearly schedule with renowned speakers from our profession, from outside of our profession, to discuss many things, especially offer the networking that we may need. We may also, along those lines, engage with our ASLM membership program. Like I've said, there are different membership levels that have been put, and we would like associations and your members to take advantage of. But more to that, we would like you to take advantage of the offerings that are already there, already within the ASLM membership structure, and extend these to your members. For example, there are forums that have been created within the ASLM membership program, and they offer networking and knowledge sharing expertise. So if you are a member, you can then join any of these forums that interest you. It could be AMR, it could be biosafety, it could be biosecurity, it could be issues around quality management system and so forth, so that they can offer that platform for you for knowledge exchange. So, Mr. President, let's take advantage of this opportunity that is being made available. So I think based on some of the recommendations that have been shared in the report, these are some of the quick reflections and offerings that we would like to put on the table as ASLM. And on behalf of ASLM, I would like to humbly submit some of these reflections and opportunities that are there that we can take advantage of. Thank you, and back to you, Shuma.
Thank you very much, Dr. Maruta and President Muvanga, for those reflections. And I see a lot of questions are coming on the chat box. Keep them coming. We'll take them, and our panelists will attend to this. So we want to start with President Muvanga. There are quite a number of questions that we would want you to attend to. The first one is an ask from Mr. Charles Rombo, the president of the Association of Kenya Medical Laboratory Assessors, who wants to collaborate and work with FeLPA, and is asking how can we collaborate with FeLPA to help improve laboratory assessments in the region, because they are actually a legally constituted institution in Kenya. So that's the first question. And to tie to that, there is also a question around can professionals who are working in laboratories that are not necessarily medical laboratories, can their associations be part of FeLPA? So if you can then also address that. Then the third one for you, President Muvanga, is maybe just to clarify who is eligible to join FeLPA, because there are a lot of questions from private labs, individuals wanting to be part of FeLPA. Today, as individuals, can we join FeLPA? So that's the first set of questions to President Muvanga. And to Dr. Tokmo, there is a question here which is seeking clarity on the absence of North African representation on the current leadership. I think there are some efforts and engagements that have been going on to try and address this. And Dr. Tokmo, you can try to address that question. And then for Mr. Sylvester, I think for Sylvester, you can then help us to attend to the question around curriculum development, to say there are a number of curriculums that have been developed in different countries. What is the thought that FeLPA has? What is the current thinking within FeLPA in terms of harmonizing curricula so that we can have a structured career development and advancement for our laboratory professionals on the continent? So I think we'll take this first round of questions and then we'll move to the second round. So we'll go in this order: President Mubanga, Dr. Tokmo, and Sylvester.
All right, thank you so much for those questions and for the engagements and for staying on. Yeah, so I'll start with the first one, which was about how can we work with FeLPA in terms of assessments and pretty much in lab strengthening intervention. And maybe before I go too deep into the answering, the FeLPA leadership team that's here, please feel free to add anything and any ideas that we've been discussing in the background so that it's not just me talking. So feel free to come in at any point, or indeed any of the people here. So in terms of lab system strength, and so you've only mentioned assessments, for example, and understandably so, because Charles, who was asked, is coming from that organization and it's legally recognized in Kenya. So riding on what Dr. Tokmo has already mentioned, when we were signing memorandums or memoranda of understanding, we included the aspect he referred to in terms of us co-implementing programs with ASLM. So as I said earlier, ideas can flow from anyone. So we may have an idea that we can implement, or you can have an idea as an assessment body that says, okay, how can we leverage ASLM and FeLPA to implement this? So you write half a page to 1 page concept, throw it to us. There's President Kithi in Kenya, who is our secretary in FeLPA, or throw it to ASLM, copy us, whichever, the information will still filter through. And then we figure out how we move to organize funding through that. In my opening remarks, I said resources follow ideas, not the other way around. So if there's a gap that we are feeling, we just highlight that what that gap is, the problem, what solution we are proposing, what resources we'll need. And then we are now going to use the engines of ASLM and FeLPA and the platform that you have given us to serve to look for these resources to implement those. Of course, we don't have the Bill Gates kind of money, but we definitely have friends and partners that can put resources towards our vision, whatever it may be. And then professionals who are not working in medical labs, can they be part of this? Yeah, yesterday when I posted about this event, a lady by the name of Hope Mlenga posted on my Facebook, in my Facebook comments. And then the challenge I have is that biomedical scientists are the ones that only seem to be laboratory professionals. So, and understandably so, but if you look at the way ASLM itself is Association or African Society rather for Lab Medicine, and then we have the Federation of Lab Professionals in Africa. It was very deliberate for us to name the organizations in that way because we wanted to recognize lab as a spectrum. Now, I know the politics that go on, and I'm sure you have encountered this in your own countries. The real issue really here is it's about the scope of practice. That's what it boils down to. So when I say this person is a laboratory scientist, it's just what kind of a laboratory scientist are they? Where can they work? Can they be interchanged, and are there environments or labs that need a specific type of laboratory professionals? So if you have been following the news again, Israel bombed Iran. and they were saying they had killed scientists there. Again, those are scientists. They are nuclear scientists. In fact, nuclear laboratory scientists. But again, to say, oh, a nuclear laboratory scientist can also work in hematology becomes problematic. So all we really need to do here is that we come together as people that are diversely qualified in the lab profession, and then we contribute our strengths. We bring our gifts and our expertise to complete the whole puzzle. So if, for example, you did molecular biology and you're working in the field that's in vaccine discovery and so on and so forth, you can be part of the associations. What does this mean at a practical level? And this may be my personal view and how I see things. What associations need to now do, in line with what I've said, is to just structure the memberships in a way that recognizes these different categories of people, so to speak. In fact, for us, even people that are not biomedical scientists can join the association as affiliate members. So you may be a banker, or we have some marketers who are not scientists, but they are marketers and they want to be members of the association. They want to be following what's going on. Maybe they're interested in bringing their products and whatnot. They have a membership level. So that's what we need to do. And then when it comes to now who does what, who practices what, that's where we now need to say who went to school for what are they qualified in, what are their competencies, and as I said, if we can start harmonizing these competencies and where should they work, which lab should have a specific type of lab professional, and again, it goes into regulation. We now go into our health professions regulatory bodies, make sure that the standards close the loopholes while recognizing the other contributions that people can make, so that we don't mix and match. You do something that's totally unrelated, to lab, and then you want to work as if, then that becomes a problem. But as far as association is concerned, I think that what we just need to do is allow for different types of memberships and benefits, and then people can join. So I hope that answers, but again, because it's a discussion, I would like to hear the other views from other people. Can individuals join as FeLPA? So FeLPA is a federation. So a federation, in pretty much any sphere, a federation is made up of a group of organizations rather than a group of individuals. And as Dr. Tokmo was saying, the idea here was we need to bring together associations to form this continental alliance. So how do you then become a member of FeLPA? You really become a member of FeLPA through your association. That's important because if you are practicing in the jurisdiction of Namibia or Comoros or Cameroon, charity begins at home, so to speak. It's very difficult to be a champion outside of your home when you're not contributing. So if you are in Cameroon, we want to see some level of involvement at that level, and then associations then bring the names to FeLPA. This is the model that we have also adopted. Our association also belongs to a federation. Most of you, at least many of you, might have already heard about it. The International Federation for Clinical Chemistry and Laboratory Medicine. The headquarters are in Milan, Italy. So again, it's the same thing. We send our people to the international conferences that are organized by IFCC. We have IFCC professors and other people coming to speak at our conferences, but that is only through our membership as a society, and no individual can skip Biomedical Society and then go to IFCC. And what they do when they're sending us a scholarship, they'll say, okay, we are allowing you guys to send 2 people or 3 people to this conference in Brussels. There was one recently. So they'll require us from the Biomedical Society of Zambia to confirm that indeed they are members, and then they'll receive that travel scholarship. So that's another opportunity that you can take advantage of. Lastly, career development. What is the plan in terms of harmonization? I think I alluded to this in my opening remarks also. So South Africa has a different one. Namibia has a different one. When you finish, then you're going to be subjected to very funny exams until and maybe even just completely fail to practice because maybe you didn't do hematology, but you have the rest, or you don't have clinical chemistry and you have the rest, and then they're asking you to do 2 more years or 3 more years for you to practice. That's quite retrogressive. Now, of course, this is not going to take overnight to change, but for us to make the change that we want, it's good that we have started talking. So fora like this will help us to move forward. And as we said in our opening remarks, both Dr. Tokmo and I spoke about it. It was for us to sort of put our fingers on the pulse of each association. What is it that they're driving towards? What do they aspire to? And we saw that issues around professional development, including the structure of our profession, it's very limiting in many cases. You only reach up to a certain level and that's it. You can't go beyond that. And then people are jumping out to go and do clinical medicine, some of them, or even accounts or whatever. But it's us looking at the structure and then being very intentional at the career progression structure from diploma to degree. Where do you go? If you get your master's, there's not even a position for you to occupy if it's in government, for example. How can we open up those? How can we create positions for people that are doctors in the laboratory profession, so that people have something to look towards? Thank you so much. I hope that I answered those questions, Mr. Shumba. If I skipped any, I would be happy to come back and the other people can also add their thoughts. Thanks.
Thank you so much, President Mutala. I think you answered all the 3 questions very well. Just to reiterate, as we see the same question coming around, who is eligible to be a member of FeLPA. So it is the laboratory associations. The laboratory associations as highlighted by President Mubanga. So we'll turn it over to Dr. Tokmo to respond to those questions around North Africa and what we have been doing to engage with the north side of Africa. Over to you, Dr. Tokmo.
Thank you very much, Mr. Shumba. And yes, indeed, I think if you look at the leadership of FeLPA right now, there is no representation from North Africa. Unfortunately, at the time that we established and launched FeLPA, we had not been able to establish any formal agreements or MOUs with any association from North Africa. And when the leadership was selected, it was prudent maybe to consider those that were present at that particular time. But subsequently, we've now engaged quite a few of the associations within North Africa, and we've already established some MOUs with some of them as we speak. So hopefully, when the new leadership comes in, there will be representation from North Africa. And we like to encourage those that are from that region to really speak to your leadership in the countries so that they can also become part and parcel of FeLPA, so that we can all get involved in the activities that are in the continent. Thank you.
Thank you very much, Dr. Maruta, for clarifying that. So we move on to Mr. Sylvester to respond to the issues around what are some of the thoughts we already have around career development as well as harmonizing the curriculum. Over to you, Mr. Moyo.
Thank you very much, Mr. Shumba. So, yeah, thanks again, Emmanuel. I think it's Emmanuel T. Cooper Senior for that question. So really, I think FeLPA, in collaboration with ASLM, we do recognize that looking at the African continent, there's a lack of harmonized and, maybe to put it, contextually relevant curriculum for lab professionals. And this is a real barrier in terms of standardizing. Then when you speak of competencies, as well as also improving the quality of the lab services, because there's nothing that is standardized. So with this in mind, we also do recognize that, you're going to have to think of a number of ways, a number of approaches rather to address these challenges. So one thing that we have done also is in collaboration with FeLPA and ASLM, I think you will have seen that also in some of the social media posts that we have shared, we have largely been talking about stakeholder driven curriculum development. So, for example, we've been engaging in some consultative engagements with the labor associations themselves, regulatory councils from different countries, academic institutions, and also continental bodies like Africa CDC, EXA, and the likes. And really, here we have been engaging these bodies to try and facilitate the development of competency-based curriculum frameworks. I'll give an example. Recently, we worked on a competency-based curriculum framework for genomics, for example, is an emerging competency that is required on the continent. And really, most of our initiatives as ASLM working with FeLPA really kind of reflect both in terms of public health aspects and clinical lab services. So that's mainly where we've been engaging different stakeholders to come up and develop that competency-based curriculum around that. Then most importantly, also as we do that, you also need to consider aligning these curriculum frameworks to global and regional standards. For example, we need to be able to think of if you are developing a curriculum that's going to be relevant across Africa, it needs to also align with international standards, for example, the ISO 15189. And if there happens to be any WHO or Africa CDC frameworks as well that speak to, for example, lab workforce development, you also need to make sure that that curriculum also aligns already with that, because then this also ensures that the curriculum that you develop is then relevant and easily recognized across the continent. So that's something that as ASLM and FeLPA we recognize, and we try to make sure that as we engage different stakeholders to develop this curriculum, it also adheres to international and regional standards. Then we also, maybe taking an example of the way we also develop this curriculum, we also recognize, people are at different stages. We mentioned that, there are students, these are the future professionals. We have people who have been working for some time. So we recognize the diversity in terms of the training levels that we need to cater for if we are developing these curriculums. So we also try to promote what I can call a modular curriculum that allows you to upskill across different competencies so that you also take care of different levels. So if someone has been working for a while, you can't your curriculum can't talk about the basic things. You need to also meet them at their level. So this is something that we also try and push, so that the curriculum also considers the different levels that are there. Most importantly, also as we develop this curriculum, we don't just aim to develop and then we just share with the countries like that. We need to also consider piloting some of these curriculum, to try and see, do they fit the context and will they really work across the continent and not just one particular region or country. So also thinking about piloting some of these curriculum in collaboration also, as Dr. Tokmo has mentioned, collaborating with the national associations and other training institutions to try and validate to some extent the curriculum that has been developed, and also get feedback from the people that we use this curriculum to. So this will also help us to continuously improve that curriculum and make sure that it really meets the requirements of the African context. Lastly, also is mentioned also, lastly, once you've developed something, you also need to consider advocating for that something. So it is something that's very useful for the professions. You also need to advocate, and in some cases, if there's a need for maybe it's related to policy adoption, you need to consider advocating for different ministries to adopt that training curriculum, as well as institutionalize it into a standardized curriculum in country. That also forms part of it being recognized. Again, I go back to what Dr. Tokmo was saying when we say, and also what President Mbanga mentioned, to say, when we say something is being recognized, who is recognizing this? So you also need to consider advocating for the recognition of that curriculum. So I think just as in summary, just to say, engaging the different stakeholders, bringing everyone to the table who has input to this training curriculum so that it fits the African continent, aligning it to the global and regional standards that are already available. This also ensures buy-in and makes sure that the curriculum is relevant and can be recognized across the continent. Also considering piloting that curriculum to make sure that it fits the context, and then lastly also advocating for its adoption across the continent. I will stop there, Mr. Shumba, and hand it back to you. Thank you.
Great, thank you so much, our presenters. We have a few more minutes, so I'll quickly pose a few questions to all of you. President Mubanga, what are some of those plans that FeLPA has in place to facilitate cross-border licensure of laboratory workers so that they're able to work in different countries using one kind of certification or license? Is this something that FeLPA is looking at? Then secondly, what is FeLPA planning or thinking around in terms of assisting these associations to move a step further from just being militant organizations, to quote the question, to being professional organizations that are recognized by governments? And if you have examples of where some of this has been done, you can also share with us. And for Dr. Tokmo, there is an issue around having so many associations in one country. How best can we then engage as FeLPA to recognize all these different associations and bring them together, as President Mubanga earlier highlighted, that working together, we are more powerful? And also, there are associations that are looking at biosafety and biosecurity. Are they eligible? How can they work with FeLPA to further the agenda of laboratory professionals on the continent? And for Mr. Moyo, I think in your presentation, you highlighted the future directions to say, where are we going? So there is a question around how can you empower with technical skills these different associations for them to be able to contribute meaningfully in their countries? So if we can quickly, in 2 minutes each, address these questions, starting with President Mubanga, Dr. Tokmo, and Mr. Sylvester.
Okay, thank you very much for those questions. Again, just testing my audio. Can you hear me?
Loud and clear.
Okay, so in terms of the plans, cross-border licensure or recognition, and I think Sylvester also touched on this. One of the challenges that's there, of course, is that the curricula are so diverse and different, from the number of years to content and things like that. So the beginning point is for us to start driving towards harmonization and working with ASLM and its convening power, which is why we are here, is for us to start talking. And in my mind, we see us having meetings and looking at these things, bring academic people, academia, together with the practice, people who are already in practice, and different stakeholders, industry as well, so that we start looking at, to borrow Sylvester's language, what is not only relevant for Africa, it must be for Africa, but also globally, we can compete and be relevant, especially with the changes that have happened now. How is AI impacting us? And have the curriculums or curricula that we are running really responded to the challenges of, say, stop work orders? Do we have leaders, lab leaders, and lab managers that can scale these challenges? And is that being taught in school? Are we still relying on 1995 or 2000 curriculums that may not really answer to the lab challenges that we have today? So we need to start talking, and there will be some compromises in terms of us moving towards that. Again, countries will be at different paces of adoption, but at least we've started as talking and as a pillar that we want to work on. And then along with that, I hope my 2 minutes is not completely over, Edwin. So what we have in mind, or at least what I envision, is that, you know, accountants have got CIMA, they have got ACCA, and these global qualifications that when you're in Japan or China, Europe, and wherever, they know the competencies that you have. That's the level of organization that I envision, at least, and that's the level of organization that we are trying to work towards as a team. Things may not be completely clear in our heads, and as we said, it might even be clearer in your minds. Let's put these things together. If you've got experience, avail yourself, and then see how we can move this piece forward. How can we structure it? How can we use the existing ASLM infrastructure to host and implement some of these things? Because we are the ones we have been waiting for. It's our continent, it's our profession, and nobody's coming to organize it for us. So whatever pops up in our minds as an idea of how we can organize, let's pursue it irrespective of where the idea comes from. So if it doesn't come from the leadership, well and good, but is it a good idea? Yes. Question number 2, who should we talk to? We talk to those people and then channel resources in that direction. The militancy, lastly. So the militancy, we really reduce the power of our associations when we become political and when we become militant. We are supposed to be professional bodies. Of course, there are some issues that we are not happy about. Maybe, as you said, it's the encroachment of people we feel may not be qualified to work in certain areas, but the way we approach matters must be professional. And the voice is louder when we go calmly with reasoned information, researched information, to policymakers to make these decisions. So one of the things that, you know, we don't do, at least in Zambia, is we don't go to write about issues in the papers, or we stand on social media and say, oh, the Minister of Health has done this and this and this. And then tomorrow, I want to meet the minister and the PS. Even if I was the minister and the PS, I would probably refuse, because we didn't sit together to reason together and explore all the options before you can say, now let me go and demonstrate, or let me go and stand on the pedestal and say, oh, look at what they've done. So for us, that has helped, because when we set up meetings with the minister will say, oh, come on this day, and we go to see the minister, we go to see the PS, and then we lay issues that we have. And the successes that we have scored have been because of the intervention of the minister as a political person whom the government and whom the country has given political authority to make political decisions for the good of the nation. So when you say this is how this is affecting healthcare, this is how it's affecting doctors, this is how it's affecting the patient, then the minister will say, oh, okay, you know, I've thought that it wasn't like this. When they understand the issue, they will make the decision. When we see there's some lag, we go back. And that way you build rapport, you build friendship with them rather than enmity. They see themselves in the papers today, tomorrow you're shouting on social media. How can they really engage you? So get your facts, your statistics. What's the impact of what you're trying to bring up? What are the stakes? And then push. I know, again, in some countries, it's very difficult to see ministers and all, but I think because of time, we can develop the ideas later. And as Dr. Tokmo said, we can now channel some of these advocacy channels through ASLM and say, okay, ASLM, we have failed to do this. Can you guys at the continental level call the ministers in one place or PSs in one place? We discuss the issue of structure, the organizational structure. Or we want to make a lab directorate in our country. We have been banging on these doors. Can you guys help us hold a meeting in our country? Call the Africa CDC, DG, call the FeLPA, whatever head, they have the convening power to do that. We come and then we talk about these things. Then when those decision makers go, they are likely to do the right thing. But hooliganism can really, really significantly reduce the effectiveness of our voices. Thanks.
Thank you, President Mwanga. Dr. Tokmo?
Thank you very much, Mr. Edwin. And I think my questions also, part of it has been answered by President Mwanga. And I like his last statement, which says, polyganism will really divide us. And the two questions I think are almost similar, asking what can we do for so many associations, and also those that are within the biosafety and biosecurity space. We know there are also associations there. How can we get involved? I think in summary and very quickly, like I said in my initial remarks, the more divided we are, the easier it is to really conquer us, and we simply diluting our voice. What I can say very quickly is that the reason why there are so many associations within the same country is because there are real pertinent issues that are making you get divided. And these issues may not be solved by joining FeLPA separately. It means those issues will always be there. So for me, I really encourage that we get organized internally before we can even start of thinking of engaging others externally. As ASLM, as FeLPA, we can come in to mediate, but I think the onus is on us to say, how do we get divided? Because my observation is that these real divisions and so many associations within the same country is because there are very pertinent issues that we have to discuss at national level. If those are solved, it becomes very easy of everything falling in place and having either one mother association that represents everyone, and there are these other sub-associations that feed into the same association, instead of having standalone associations that are seeking to engage FeLPA and the ASLM as individual separate associations. So for me, I really want to throw this ball back to our colleagues in the countries that we need to get organized internally, make it easier for us to have a focal point or a single entry, which can make it easier for us to engage. Thank you.
Thank you very much, Dr. Tokmo. Mr. Moyo?
Thank you very much, Mr. Shumba. Please confirm you can hear me.
Loud and clear, sir.
Great, thank you so much. So yeah, for the question around how FeLPA and ASLM would be supporting the association, I think just to in summary, empowering the labor associations with the technical skills that they need, I think is something that's very central to ASLM and FeLPA in terms of our vision, our joint vision for building strong self-reliant national lab professional bodies. So to ensure that associations across the continent are ready to contribute, FeLPA and ASLM are really focusing on building both the technical and the operational capacities that have been highlighted in the report. And this includes really looking at how we can provide, for example, tailored training around project management, financial compliance, as well as technical reporting, which are gaps that already the medical labor associations themselves have identified and highlighted in the report. Also, FeLPA and ASLM are looking at ways that we can explore in terms of supporting through mentorship and also peer learning exchanges. That's why we are also bringing the lab associations together. We, as mentioned, we have associations that have been in existence for 9 years, and some for as much as almost 60 years. So we have a variety of experiences that are existing across the medical lab associations, and we want to create a platform. This is why FeLPA was formed, to create this platform where we can cross-pollinate each other and learn from each other's experience. Some associations, for example, they've already established innovative ways that they've been using to improve their financial independence already, and others can learn from this. There are also some already available tools and templates that have been used by ASLM, as well as also some of these associations that really make technical work easier and more aligned to what the donors expect. So this is something also that we hope that through FeLPA, collaborating with FeLPA, we can try and share this, make this available to the medical lab associations so that they can use this and make and build their technical capacities. So lastly, I have to say this, where resources allow, ASLM through collaboration with FeLPA really will continue to engage associations, as mentioned by Dr. Tokmo, in terms of identifying small projects or small grants that we can collaboratively do together, so that through these projects we also use that as an opportunity to help strengthen the institutional capacity of the medical lab associations. And then really just to say that all of this is already anchored in the formal agreements that we mentioned. We have memorandum of understandings with some medical lab associations, and this is already highlighting some areas of collaboration. And also these MOUs kind of clarify the roles between ASLM, FeLPA, and the Medical Lab Association, so that we have a structured engagement moving forward. With that, I thank you and hand back over to you, Mr. Shumba.
Great, thank you so much, our presenters. We are coming to the end of this meeting, and I really want to extend my heartfelt thanks to all of you for sharing your expertise with us, and for the active participation from all our participants, the thoughtful reflections, and the commitments that we have seen. We are a few minutes out of our time, so I'll invite our President and Chairperson for FeLPA, Mr. Muvanga, in a minute to just give us his parting words. Over to you, sir.
Thank you very much again, Edwin, and thanks to everyone that joined. Thank you to Dr. Tokmo for the leadership, Sylvester and the science team that has been working on this report for some weeks now and doing the legwork for us and the continent. We truly appreciate. We want to thank the participants that joined. We hope that this has been insightful. And we are very cognizant that we will not do everything in our time, but we hope that we are laying a strong foundation even for people who will come after us to build on this as we continue to organize the profession for the safety of our patients, including us who may be patients, for the safety and the sake of the community. Thank you so much. The train has started moving, and we hope that it will continue moving.
Great. Thank you so much, President Muvanga, for those parting shots. Thank you so much, colleagues, for joining us. As highlighted earlier, we will be sharing the report in English, French, as well as Portuguese for your perusal. And feel free to reach out to the ASLM Secretariat so that we can move this agenda forward. With that, I wish all of you a great evening, a great morning for some of you. Bye-bye, and have a good day.